Williams, two students who've completed the project being presented today and whose work contributed directly to its development and outcomes. So let's get started. Thank you, you fantastic trio, for being here with us today. So tell me a little bit about the project. What is it and what did you achieve?
Our project started several months ago when we had, and this person's actually on the call, a very insightful talk by somebody who's lived experience of being a trans person and their experience of healthcare access in primary care and other NHS organisations. And that very inspirational talk led us to think about how we needed to, should we say, change the way we do things in primary care to adapt to people who are transitioning or who have transitioned, because we recognise that they are a massive health inequality, and that they also, because of the fact that sometimes we don't know their original identity, that they're missing out on in very, very vital healthcare, and more importantly, screening processes that are really important to us in primary care. So that's how it started. I'll let you ask the rest of the questions because I don't want to speak over these two.
No, absolutely. So tell me what was involved in it. What was really important about the project to you both?
Yeah, so I think what was really important more so was making sure that surgeries within Cheshire and Merseyside were inclusive, and that people who identified as transgender felt safe going to see their general practitioner. A massive part of it from my standpoint was being part of the LGBTQ community myself. There's a lot of areas where you don't feel like you can have that open and honest conversation through, as awful as it sounds, potential judgment from practitioners, because you don't know them. You only know them in a professional role, in a professional capacity. So it's about being open and transparent with them and explaining that sometimes you don't know everything, and finding out how that person likes to be identified as, making sure you're aware of what the pronouns are. So it's just, for me personally, it was more about making people who identify as transgender safe.
And do you feel like when you feel comfortable and safe, you're more open than about your health issues? So then therefore your patient care is better?
Yeah, absolutely.
Yeah. And as well, for me, it was more having the understanding as well, and being able to be confident enough to ask uncomfortable questions, but obviously taking people, being respectful as well, but having that confidence. So by training and again speaking with people with lived experience as well, I think is really important.
So tell me about the project. What did you achieve? What has it done? Where did you start?
So we started. We started with our talk. Obviously, we then went and developed with the last cohort, which these two were part of. We developed a poster encouraging trans people to have smears and identify their gender. And then this time we thought we need to do more, actually, because there's a lot of other screening methods that we're missing out on, really. And so we developed a whole sort of theme about the importance of identifying your gender to us in general practice. So we did a set of posters for every screening. So AAA, bowel screening, cervical screening. I think you've got copies of those, Carla, haven't you? We also did a leaflet around the importance that we could leave in people's waiting rooms, around the importance of identifying your gender to us in any medical setting, but particularly us in primary care, and how to go about doing that. And then all of the students, the two here and the rest of them, presented to people in Sefton about differences we could make in practices to address what Dyllan's just said, how to make people feel safe within a practice. You know, when they come in and book an appointment, is there something that they might think, oh, these people are trans friendly? Is there a little flag somewhere? Are we asked about their pronouns? Nothing worse than being screamed your name at, you know, people that's at reception shouting your name if it's the wrong pronoun. You know, all of this sort of stuff, dead easy stuff, Alex, wasn't it? You know, both of them agree. It's very easy. People that came to the talk were quite blown away, weren't they?
Yeah.
One of the practices went away and they all bought the rainbow lanyards for all of their staff. So at least when people come in, they think, oh, these people are friendly. These people, I feel safe here. They're going to accept me. So that was very much a big part to educating other people on other practices. And hopefully our work will continue now. And we're hoping that they're going to, our practices around Sefton are going to show our work in their waiting rooms, etc. Yeah. And hopefully with this as well, we're going to have the recording and we can send that round as well, which will just boost our boost the work that we've done.
Yeah, and like you were saying, those things don't cost money, do they? They're around that sort of training elements, and lanyards are quite cost effective as well. So how did you find that it's been implemented then? Do you have any evidence to show that it's made a difference yet? How has it been received?
Well, for example, Alex has just got a new job in her practice down the road here in Bootle, and she's requested the posters. So I'm pretty sure that next time I walk into Park Street Surgery, that they're going to be up. Because the students are all involved, and because we're quite lucky that most of them have found employment round and about, then they're going to be up, up in surgeries around this area. It's not easy, is it, to sometimes implement things like this, and it's a slow burner. But what I will say is that when you have, I'm not blowing my own trumpet when I say this, but there's no way I'm going to let people not display their work, because this is the value of having students in primary care. This is what they bring to primary care. This is everything that the training hub is about them. So I will be knocking on doors and asking people to put the posters and the leaflets up for patients. Really, because that's what it's all about. It's about student nurses, students in practice, and ultimately about better patient care, and that's what it's got to be all about. So yeah, I'll be championing it for them as well as them doing it themselves. And the posters are up in your practice.
Posters are up in the practice that I'm in, yeah.
Yeah.
And we actually do. I find when a lot of patients come in to see myself, they do actually question it. What's it for? What is it you're trying to highlight? The most recent I had was a patient who they didn't really understand transgender, which there are a lot of people in society that do struggle with it. And it's about us pushing that narrative of, well, this is what it is, this is how we can support people, and this is how we can make people feel safe. So by having a poster up that's in relation to a cervical screening, to make sure that these people are, one, identified, and two, feel that they are able to come and have their cervical screening done within a practice, such as the practice that I'm based at. For me, it's mostly about pushing the narrative of we care, we're compassionate, and we want you to feel safe.
There's that less judgment. People feel more confident in opening up to you. They feel like they're going to be addressed correctly. They feel like you're going to be competent and capable because you understand what it means to be transgender. And all of that, I'm sure, will mean that you have a more open conversation about health. I'm just wondering, I know this was one of our questions, but do you feel like doing these types of projects will influence you on your career now? Because I know that you're both within primary care, but actually changing the status quo is very difficult. As Maggie said, they can be really slow burners. I'm just wondering, has that give you confidence to kind of look at other areas as well that may need changing?
Yeah, I mean, for me, like I said before, it gave me confidence to maybe ask them uncomfortable questions and highlight to people the importance of reasonable adjustments that can be made when coming to the GP surgery. And it's just a conversation. It doesn't have to be a scary conversation. There's no judgment at all. So when they come into practice, if they might want a male, they might want a female, if we can make that adjustment, we will. I think is the most important thing. And for me going forward, I will always make sure the adjustments are there if we can.
Yeah, it's not difficult, is it? It's conversations that we should be having with every patient, not just our transgender patients, because everybody has a specific way that they identify. Everybody has a specific name that they prefer to use. So these are conversations that we should really be having with everybody that comes into practice. We've just kind of highlighted it more around our transgender community because that's where we're probably falling more so, because it's a difficult conversation
And they're easier to avoid, aren't they?
Yeah.
I think the other thing to say, Carl, as well, is because they've all learned this, and you know the faces on them when I said, "Will you present it?" was like, you can imagine. She was, he was shaking. Never seen him lose his bottle before, but he did. But Alex was literally wobbling like a jelly, and you know wants to throw darts at me. But the point is that when they do things like this is the confidence they get then to take things forward.
Yeah.
So now she's got the confidence. She doesn't care. Dylan never cared, to be honest, but even so, he's very nervous. But people, you know, students like Alex, they've got the confidence. They'll take that into practice now. She's obviously already made an impact because the posters are going up. Yeah. She's going to educate her practice, you know, fellow team of nurses, and a lot of feedback's come back from the mentors that they're like, actually didn't think of things like this before. So the ripple effect of the students going out into the practice, making a huge difference among all the practice supervisors and assessors about their own way of thinking and their own knowledge is quite huge. So I think that's worth saying, isn't it?
Yeah. And especially going forward as well for future students that are going to be with us, we can emphasise it a lot more as well.
Yeah.
Which I think will drive change anyway.
Yeah. Well, I think Maggie's just hit the nail on the head, really, hasn't she? So as she said, it's the ripple effect. Yes. So we've dropped the pebble, and now we're watching the ripples come from it. And it's going to take time. It's not going to change overnight. But our generation of nurses that are coming through that are more aware of transgender identity and aware of the things that are going on within society, we can drive that change to support it for the better.
I'm going to stop the recording there, if that's okay with you all, and I'm sure we're going to get some questions. But fantastic response. And you don't